Good evening, everybody. I'm Dr. Arvind Krishnamurthy, Professor and Head, Surgical Oncology from the Cancer Institute, Adyar in Chennai. At the outset, I would like to thank the Starhealthinsurance family for giving me this wonderful platform for interacting with you today. Today happens to be a very special day, the 8th of March, at the International Women's Day, a day which is associated with a great deal of symbolism. Ask me if you really need one particular day to celebrate Women's Day, I would say no. Don't get me wrong here. Considering the achievements that women do towards their family, towards the community, towards the country, I feel that every day needs to be celebrated and glorified as Women's Day. Incidentally, today is the 110th International Women's Day. What started off as a labor movement possibly about 110 years back in the early 19th century, 1908, today has become a day of celebration all over the world. The United Nations took this up as an important day of celebration in the year 1977. Every year there is a theme, and this year, that is 2021, the theme is Women in Leadership, Achieving an Equal Future in a COVID-19 World, saluting the enormous contribution made by women in the healthcare and in the frontline workers. According to the International Women's Day website, the theme is #ChooseToChallenge. The call is actually to urge people to challenge and raise their voices against gender bias and inequality. In India, we have a very unique challenge. What happens is that India possibly is the only country in which a woman is revered and worshipped as God as well. On the other hand, sometimes in Hollywood, we do have some of the women having temples for their own, but barring that, we are by and large a patriarchal society. So women's rights, although it's guaranteed in the Constitution, there are lots of government schemes, central and state government, to protect women's rights. Sometimes in reality, we find that some of these rights may not be there for them. But according to me, the most important rights for women is the right for education or right for the girl child. And very recently, I found that a couple of weeks back, in fact, the Tamil Nadu Dr. MGR Medical University had their 33rd national convocation in which Prime Minister Modi was the chief guest. And incidentally, over 21,000 degrees or diploma or certificates that were given, 70% of them were actually women. So we were doing pretty well in terms of girls' education. So a lot of women we find today in the field in the workforce as well. So traditionally, women's role was largely confined to the household caring, but now we find a woman playing a dual role, a lot of women being in the workforce, and they are being breadwinners as well. So sometimes the women actually find it hard, or sometimes it's physically impossible for them to sort of achieve the elusive work-life balance. So as a result, what really happens is they tend to have very, very less time for themselves, very less time for their health. They tend to sleep less. They tend to sort of eat less, and a lot of these risk factors seem to be associated with the occurrence of cancers and also a part of other non-communicable diseases. A peek into a very recent survey that was conducted by the National NCD Monitoring Survey said about 1 in 3 adults were tobacco users, 1 in 3 had elevated blood pressure, 1 in 10 had elevated glucose, a fourth of the adults were found to be obese, and about 2 in 5 had increased or insufficient physical activity. What we find is all these things are risk factors for development of cancers. And when it specifically comes to breast cancers, we see that some of the symptoms that are actually meant to portray an early risk factor or risk factors are an early menarche, a late menopause, a late age of first pregnancy, compromised breastfeeding, etc. And we find that a lot of women in the workforce today are pushed into some of these because their biological clock and their career clock seems to be at conflict. And as a result of which, they have a lot of high risk habits that sort of make them susceptible to cancers. I must say that cancers per se are a lifestyle disease. Incidentally, in the year 1900s, we never really had many of cancers. And it's only over a period of the last 100 years or so, we have a lot of cancers. And coming to certain women cancers, I think some of the more common cancers, at least in women, seems to be the breast and cervical cancers, and among male seems to be lung and the oral cancers. So let's throw it up. With this short introduction, I'd like to sort of throw it up, and I'd be open to answer any question which is related to health, wellness, prevention, treatment, management, palliation, anything about cancers. Okay, the first question that I see here, Ms. Archana asks via email, is our cancers curable? This is a million-dollar question, but I must say that the curability of cancers generally is related to the stage of cancers. Normally, cancers are divided into 4 stages, stages 1 and 2 being early stages, and stages 3 and 4 being advanced stages. And once cancers are diagnosed at early stages, the chances of cure rates are pretty high. Certain cancers in the body also have certain higher cure rates, for example, hematolymphoid malignancies in children, testicular cancers in adults. So the crux is to diagnose cancers at an early stage so that the cure rates of these cancers are pretty high. The second question, what I see in the box, Rahul asks via email, is are cancers contagious? Well, definitely not. But I must say this is a myth that keeps floating around, and this happened even the previous week. In fact, there was an elderly gentleman who had come with advanced cancers, and I had informed the patient and the family that the cancer had spread in the body. And in fact, after the end of the consult, the family members came to me and asked me whether they are at risk of getting the cancer from him. So this is something that, although seems to be pretty common knowledge, the doubt keeps lingering in the minds of the patients. I must emphatically tell you all that there is no scientific reason to tell that that cancers are contagious. Satya asks, why does a patient without habit get cancer? I think that's a thing that I actually commonly see in the clinic. As I said, a lot of cancers, the reason why cancers come are multifactorial. It's a combination of possibly genetic and lifestyle habits. And a lot of lifestyle habits are associated with cancers, like alcohol, tobacco, diet to an extent. And it's not uncommon for a patient to actually get cancer without any habits. In fact, in our own study, in our own publications that we have seen, at least in 3 or 4 cancers, at least in tongue cancers, in both men and women, in lung cancers, we find the association of tobacco is not that much. Ms. Vandana Pandey asks, what are the symptoms of cancers in the first stage? I must tell you, Ms. Vandana, it all depends on what is the subsite of cancers. In fact, cancers can occur anywhere in the body from head to toe, and the symptoms of that particular cancer would depend on that particular subsite in which it arises. The next question, what I see is Dheeraj asked via email, why do some patients with habits get away without cancer? And this is a common sort of, a defense mechanism. Some people say, they say that some of my relative used to smoke for close to about 70 to 80 years. They lived long for about 100 odd years. They never really got cancers in their lifetime. I must say that all this is sort of it's all by chance. For example, if a person consumes tobacco, the tobacco is actually metabolized by the liver and excreted by the kidney. And there are some people who tend to sort of be slow metabolizers and fast excreters. and some of the cancers, and they may be prone to some of these cancers. So not everybody who consume tobacco or any other substance abuse may actually get cancers, but on the contrary, these patients seems to be at high risk for developing these cancers. Yeah, the next question, as I say, Ms. Samira Roop says the third stage thyroid cancer survival is 9 years. What is the prognosis of these cancers? Some of the cancers, I must say, are sort of good cancers. Although no cancer per se is good, I must say that in terms of cure rates, we are able to identify some cancers, like for example hematolymphoid malignancies in children or the pediatric population, testicular cancers in any age, adolescents, and even thyroid cancers. The cure rates of these cancers are pretty high. For example, in thyroid cancers, you have a plethora of quite a heterogeneity in terms of cancers. The most common of these cancers are the well-differentiated thyroid cancers, and some of these cancers have got a 20-year survival rate of around 99% or so. So some of the well-differentiated thyroid cancers, the good cancers, patients tend to live much longer. On the other hand, at the other end of the spectrum, you have some patients with some a more aggressive form of thyroid cancer called the anaplastic thyroid cancer, in which the average or median survival is around about 6 months or so. So by and large, thyroid cancers are good cancers with good and very high cure rates. Dr. Ajit Kumar Pradhan asks, how many types of cancers? As I said, there are more than 100 or so types of cancers. Cancers can affect any part of the body, right from head to toe. So no body part is actually sort of immune from getting cancers. Ms. Amira Kyle asks, what are the preventive food habits for cancer? And this is a very important question. In fact, diet plays a very crucial role in the occurrence of cancers. In fact, there are certain cancers like the breast cancers, the endometrial cancers, which are caused because of obesity. Sometimes diets are also protective. For example, what the recommendation is to have about 4 to 5 servings of fruits and vegetables per day, and a lot of cancers can actually be prevented because of certain good food habits. In fact, from the perspective of prevention, the scientific experts say that you must have preferably a plant-based diet consisting of more fruits and vegetables, avoid certain substances like processed meat, red meat, fried foods, salty foods. And salty foods is also very, very important. The average salt consumption, according to the WHO, is less than 5 grams a day. And very startlingly, in India, we have the average consumption of the population seems to be around 8 grams. That is, more than 96% of the people tend to sort of have a much, much higher salt intake. Right. Edward asks via email, any magic pill or vaccine to cure cancer? Of course, we are in the COVID era, and a lot of buzz is going about the COVID vaccines. In fact, just to put this in context, I must say that cancer patients should be on a priority basis to get the COVID vaccines, and we have written to the government for that. Other than patients who are on active therapies like chemotherapies or suppressive immunotherapies, every other patient can receive the COVID vaccine. Coming to the question here, there are certain cancers that can be prevented by vaccines, and two of the common cancers are, one is the liver cancers and the other is the cervical cancers. Liver cancers are, some of the liver cancers at least, are caused by the hepatitis B virus, and you have the hepatitis B virus vaccine, the hepatitis B vaccine, as a part of the national immunization program, and such vaccines are preventive. The other aspect is that cervical cancers, and this is very, very important, and this is a very important relevant cancer for women. You have the cervical cancer vaccines. In fact, two types of vaccines, the bivalent and the quadrivalent vaccines, and it is highly recommended that girls in the ages of 9 to 14 take that vaccine, catch up ages up to 26 and even up to 45. These vaccines are actually available over the counter, and sometimes you will have to, of course, take it under the supervision of your particular gynecologist or pediatrician. Ms. Visalam Ramanathan asks, what's the prevalence of cancers in depressed patients? It's a slightly difficult question to answer, but I must tell you that a diagnosis of cancer itself causes some form of depression or distress, as what we call. In fact, the National Cancer Cooperation Network actually says that distress has to be measured as an important vital sign, like we measure pulse, blood pressure, respiratory rate, heart rate, etc. We must measure distress also. So we, as oncologists, have what is called as a distress thermometer, in which we tend to sort of screen for distress among these patients and then take a detailed questionnaire among these patients and try to address them. But major depression happens in a slightly lesser amount of patients, and some of these patients who are screened and identified are referred to specialist services like the psycho-oncology services or occasionally to the psychiatric services. Ms. Amira again asks, any relationship with cancers and lack of sleep? Well, there is no robust association from the scientific perspective that I can actually say, but one thing is there, a lack of sleep or definitely sleep habits that are not proper causes a lot of stress, and possibly some of this can cause some other symptoms like improper dietary habits and depressed immune systems, which could be an indicator or sometimes can lead to cancer in some of them. Mr. Rams asks, what are the symptoms of liver cancer? Sometimes again we'll have to go by the association. A lot of the liver cancers, as I said, are because of associated with alcohol, and some of them could be associated with certain viruses like the hepatitis B and the hepatitis C virus, and some of the symptoms would be very vague, abdominal pain, sometimes the liver may be enlarged, sometimes you may have jaundice. So and there are variable symptoms. You could have a loss of weight or loss of appetite. So these are some of the symptoms, at least, of liver cancer. Ms. Anandi asks via email, is cancers, are they genetic? Only about 5 to 10% of the cancers, I must say, they have a certain genetic predilection, and there are certain genetic associations. For example, the more common or the most popular ones are the BRCA mutations, the BRCA1 and the BRCA2 mutations that are associated with sort of breast cancers, and this is purely, a lot of us are trying to will connect with the Angelina Jolie effect, in which she had the deleterious BRCA1 and mutations, and she underwent risk-reducing surgeries like a double mastectomy and prophylactic self-finger oophorectomy. A lot of questions throwing in. Sorry, I'm actually trying to go slow, but I'm trying to sort of address as many questions as possible. I'd like to know, Madhu asked via email specifically about breast cancer screening. If a woman knows that she's BRCA mutation, when should she actually have her MRI breast screenings done? Well, I must say that in case of BRCA1 mutation, it is known there are very many ways to go about it. Women can actually have regular surveillance with MRI screenings around the ages of 25 to 30 onwards. In fact, they say that MRI is much better for some of these women rather than the regular mammographic screenings. Some of these women also can undergo chemopreventive strategies, or some of these women can also, after completion of their families, also have risk-reducing surgeries. Of course, it's all dependent upon the risk perception, but it's very important that some of these women actually speak to the genetic counselor prior to embarking on such steps. how often that mammogram should be done for her children after 40 years of age when um, a woman is diagnosed with early breast cancer around 65. It's a fully loaded question. I must say that family history is a very, very important aspect of breast cancers, and on an average, the risk would be around 1 in 12 in the population, or 1 in 28 to 30 in case of Indian population. But if there is a family history of breast cancers, that is, if it's there in your mother, aunts, or any other person, then it's sort of, it's very, the people are at slightly higher risk. And generally, the dictum is that to start screening about 5 to 10 years earlier than that. But other than that, I think the general screening recommendation is to start, that is for an average woman, to start the breast cancer screening by the ages of 45, and very recently data saying that even up to 50 years as well. So I think the recommendations are varied, and very recently also you've got some data, at least from the Indian perspective, rather than mammographic screening, to go for clinical breast examination. So more than anything pertaining to women and breast cancer, the pragmatic solution for a country like India is for women to be breast aware. Breast self-examination was promoted earlier, but there is not much of scientific evidence to back that. But it's important that women tend to be breast aware. And what is more important is the clinical breast examination. And we have one of the largest randomized controlled trials coming from Mumbai saying that clinical breast examination, at least in women more than 50 years of age, has got a potential to sort of, reduce the risk of breast cancers by around 15 to 20 odd percent. Again, a lot of questions are coming up. Priya asked via email, does sugar feed cancer? And again, I think this is a sort of a myth. There are a lot of messages floating around, and especially in social media, that some of these foods like milk and sugar, they possibly cause cancers. But I must say that one must reduce the intake of some of these sugar and complex carbohydrates. Sugar per se, the consumption is not good, but there is actually no evidence to actually suggest that sugar actually feeds on particular cancers. But yes, it is important that one must reduce the intake of sugar, especially that is present in carbonated drinks, which is becoming a fad nowadays. Again, a lot of questions coming in. Vidya asks by email, most often fear is because of cancer treatment is going to get more difficult and the pain of a growing cancer. Why is that so? Well, that may not be the case, I must say, unfortunately, Ms. Vidya. It may not be the case right now. In fact, as oncologists, we try not just to sort of cure cancers, but at the same time focus on the quality of life of our patients as well. So we try to make cancer treatment as less and not with much pain or any other thing. So our focus, of course, the primary focus of our treatment is definitely cure for these patients, but at the same time, a lot of focus and emphasis goes on the quality of life of these patients. And earlier, for example, at least from the surgical perspective, there were very, very radical surgeries. Now what's happening is surgeries are getting more and more minimally invasive. We are doing more and more laparoscopic, thoracoscopic, robotic surgeries in which the hospital admission time is shorter. The patient recovery is also pretty short, and the hospital time is also very short. So even most of the therapies when it comes to the systemic therapies are also become more and more targeted. We are more and more moving towards precision medicine rather than a one-size-fits-all approach. Now most of these targeted therapies seem to sort of be more focused precision therapies, and a lot of immunotherapy buzz is there. So we are actually trying to target the things and try to improve the quality of life for these patients. And again, a lot of questions, and Bobby asked via email, why do people with the same cancer get different treatments and have different problems? Well, I think it's probably it's a very wonderful question, but I must say that more and more the cancer treatments are getting more and more personalized. As I said, the initial approach was a one-size-fits-all approach, but that's not the case. Nowadays, we are taking we are as a part of the diagnostic evaluation of cancers, we are trying to sort of take the cancer, subtype the cancer, and sometimes classify it into various buckets, and then try to give focused or precision treatment for those particular patients. And that's the reason why treatments may vary between patients of same stage and same age as well. Well, Sriram asked by email, fatigue seems to be a big part of my treatment. Is it a real symptom? Yes, Sriram, I think there may be an element of fatigue. Fatigue can arise during treatment, because some of the treatments, especially if they are slightly aggressive treatments, they tend to be a little, they tend to suppress the immune system. So fatigue is one of the symptoms that may be there in treatment, but generally with time, all these things tend to settle down, and you must sort of discuss with your doctor whether there is any other aspect, any physical or metabolic aspect that's contributing to your fatigue. A very minority of the patients may get something what is called as a chronic fatigue also, and that can also be addressed. So yes, I think I must say that you must sort of discuss with your doctor prior to taking these treatments. Well, I think I've really answered quite a lot of questions, and I must say that that we are almost coming to the close of the session. I think it's half an hour seems to have breezed past so quickly. I didn't realize it was on, but yes, anyway, thank you very much, all of you all, for joining with us today evening for this interaction. And I must say, if you have, I'm sure you must have many other medical queries. If you have any other second opinions or any other queries, we will be very happy to sort of reach out to you. And some of the questions which we could not take up during these, I would try to answer some of them by the chat services as well. And I think some of us are, I'm actively trying to do that. And also, apparently, I must again congratulate or thank Starhealthinsurance for giving me this opportunity. And I must say that the Starhealth team apparently has got a very good telemedicine services as well. And you can avail these free services between 8 a.m. to 10 p.m. on all days by downloading the Talk to Star app or calling this number that's projected on your screen. But in case you have any other queries with regards to health, wellness, or any other symptom other than non-cancer as well, I think you are free to download the services of the Starhealth. Watch the space for more such interaction, and I would love to be back with you all. Have a great evening. Thank you. Jai Hind.